At 1 minute past the top of the hour, you're probably waking up right now and unafikiria maneno ya kubrush meno, and that is a conversation that we're having this morning. Maneno ya oral hygiene yako, how does it look like and how important really is it? And we have some models here. Na mzito, Dr. PJ Muruki.
Yes.
Karibu sana.
Asante sana.
A number of people have seen you here, but then kuna wale bado hawaja kuona hapa. You can tell us who is Daktari?
All right, so my name is Dr. PJ Muruki. I'm a dental surgeon by profession. I'm actually the chief dentist in Nairobi County.
All right.
And it's a pleasure to be here as we continue this journey of demystifying dentistry. Yes.
Oral hygiene, first of all, because when you mention oral hygiene to a number of people, watajua unaongelelea meno tu. Demystify for that, as for that.
All right.
How far does oral hygiene encompass?
Excellent. So whenever you're talking about oral hygiene or the oral cavity, most people think it's just teeth. But the oral cavity has many components, all right? So it starts from your lips, all right? Then it gets inside your mouth, there's a tongue, there's the teeth, and the teeth are anchored inside the what we call the alveolar bone and the gum. Then of course we have your cheeks on either side. And then we have the palate, that is the roof of the mouth. You can
probably, because you have the models here.
Yes.
Excellent. So tumeanza na lips.
Tumeanza na lips, side ya nje, all right? Then of course when you get on the inside, or on either side of this, we have the cheeks, all right? So on the inner surface of the cheek, that's still the, it's called the buccal mucosa. It's still part of the oral cavity. Then of course, at the floor of the mouth, we have what we call the tongue, all right, still part of your mouth. Then on top here, we have the hard palate and the soft palate. The soft palate is the one that is at the very end. And at the very end of the soft palate, we have what we call the uvula, all right, ile watu wanaitanga kilimi, ile pale nyuma kabisa. Then at the very back of the tongue, there is what we call the oropharynx. Yes, so all those are components of your mouth. And whenever we are talking about oral hygiene, we are talking about the hygiene of all those tissues, not just the teeth. Yes.
And I think when a number of people say the teeth is because that is where they can actually reach when it comes to, I can probably use, let's say this one.
Yes.
They just brush the teeth. Watapitisha kwa gums pia. And some on the tongue. And that's just it. But then you also mentioned on the inner side of the cheeks. Where a number of people won't really be able to also safisha hapo vizuri. So, I mean, kama your kiulimi, how can you ensure the oral hygiene of certain parts of the oral anatomy when you can't actually clean them?
No, actually, whenever you talk about the oral hygiene, you also have to talk about how you maintain them. So it's not just about the brushing. So for example, if we start even with the lips, number one, hydration is very important because the mouth, the way God made us, we have saliva. So saliva is what does what we call self-cleansing of some of those tissues that we are not able to reach. And just around your mouth, you have very many salivary glands. You have what we call the parotid gland just on the side of your cheeks. We have the submandibular, which is below your jaw, and the sublingual, and all those produce saliva. So if you are not well hydrated, it means also your mouth is not having enough saliva, and saliva has a self-cleansing action. So we need first to start with making sure that the mouth is well hydrated. Then now when it comes to the brushing bit, you make sure that especially your teeth, because we say you brush your teeth. Once you finish brushing your teeth, and I hope you're going to demonstrate how you're going to do that, we also want to make sure that some of those soft tissues are cleaned. This includes your gums, all right? It includes your tongue, it includes your palate, and the tongue, the area that is just very behind what is called the oropharynx, all right? So if you just clean your teeth, exactly, it's important, una brush pia hapo hivyo, because ukibrush tu meno peke yake, then it's going to be, you are leaving out some vital structures that should also be cleaned. But like I said, even taking care of your lips, including if you're working out in the sun, you just apply some, lip balm, which is going to keep them hydrated. That is part of taking care of it, and drinking a lot of water.
Right.
Yes.
Apoko, lots of water, as someone who's experienced in this.
Yes.
How much will you recommend?
No, I mean, of course, many professionals will say different things, but you know, if you're able to take at least 2 liters per day, I think that's enough. And also you keep every now and then, it's not like you take it once, you just keep taking during the day, because if you just take it once, utaipeleka tu kwa lu after 1 hour. So you need to keep hydrated, you know. Every so often you keep sipping some water. Yes. All
right. So I want us to start off with someone has woken up, like right now.
Yeah.
It's about 9 a.m. Someone has just woken up.
Yeah.
They're probably just preparing to leave for work in the next 1 hour.
Yeah.
And all this oral hygiene has to be factored in their day-to-day routine.
Yeah.
So they have wametenga about 3 or even less than. Let's even say just a minute or 2 for their oral hygiene.
Yeah.
Walk us through how someone starts off their day until hadi usiku when it comes to their oral hygiene entirely. So they've woken up.
Yeah.
So what's the first thing they do when it comes to their oral hygiene?
All right, that's a good question. So when you wake up in the morning, actually I'd want to start at night.
Okay.
So the last thing that you do before you go to sleep should be brushing. So once you brush at night, we actually say, if you want to keep your friends, make sure you brush in the morning. But if you want to keep your teeth, make sure you brush at night. All right? So at night, it's very, very important, because that is when you are not using your mouth. All right? So you're not talking, you're not drinking, you're not doing anything. So the mouth has a lot of bacteria. And of course, you have just taken your meals at night, the supper, right? So there's a lot of food debris that is left in the mouth. And the bacteria in the mouth, if that environment, you've not cleaned the food, the fermentation changes the bacteria in the mouth that were what we call normal flora to harmful bacteria. And this is the time that now it causes a lot of damage even to your teeth and your gum tissue. So you make sure at night before you sleep, you brush, and you normally say at least for 2 minutes, all right? Then now when you wake up in the morning, you had already...
Is it subjective to maybe what someone would have eaten? Hear me out. So if I just probably had, if I actually had a whole meat that is involved, and the chances of itabaki kwa meno nini, or some foods that are very rich in fiber, and the chances that the strands of this food are going to be stuck hapo kwa mdomo, kwa teeth, that's when a majority of people would now say, let me brush my teeth because of what I had eaten. But then if you just had a very simple meal, in this case where I come from, a simple meal at night, maybe just rice and rice and beans maybe, rice, something that won't, the food strands won't hazitabaki kwa meno. Is that a valid reason not to actually brush at night?
No, you should brush nonetheless, you know, because...
you
know, the fiber, like meat, you actually feel the urge because it's packed in between your teeth, right? So the normal food, of course, if it's soft, then what it does, it just seeps in between the teeth without causing the discomfort, right? So whatever the case, you have to brush. And in fact, we normally say, if you are able, you first floss. Flossing is cleaning in between the teeth. And then you brush. So it doesn't matter. It should be a routine. So at night, you have to brush before you go to sleep. Right? And we normally say at least for 2 minutes. You take your time and make sure you brush all the teeth, all the surfaces of the teeth that you're going to see, and also you make sure you take care of the soft tissues, that is the tongue and the rest of the issues.
This 2 minutes also applies for the morning?
Yes, in the morning also. When you wake up, please first take your breakfast. Most people wake up and brush. So you take your breakfast. The best you can do probably is rinse your mouth if you feel like. Because remember, you had brushed. The last thing that you did when you're sleeping is brushing. So you first eat your breakfast, then you brush. Because the reason why you're brushing is to remove the food that will be stuck in between the teeth.
So what if you had not brushed your teeth before, at night? Is it a valid reason to brush before you have your breakfast, and then now maybe after brush again?
Let me put it this way. You know, it's not anything that is cast in stone. You know? This is about your oral hygiene. So even if you brush 5 times, if you're able, it is okay. You know, so you can wake up, brush, Then eat your breakfast and brush if you have that time. The 2 times we say it's at least 2 times. All right, so in the morning, and we look at the practicality of it, because in the morning you're taking care of a few things before you rush to work. So therefore, if you brush before taking breakfast, most likely you get late and you're not going to brush again. So it's just the practicality of it, but just as a guide, and we say at least. So in the morning, remember there's that song we used to sing. I wake up in the morning, I brush my teeth, I eat my breakfast, then go to school. That was, misinforming, right? So it's supposed to be the other way around. You take your breakfast, then now you brush, and then you can start your day. Then during the day, because you'll have lunch, if you're able to brush after lunch, well and good. If not, at least rinse your mouth. You rinse your mouth, and then now in the evening, you will be able to brush again.
Right. But many Kenyans would be wondering, what breakfast am I taking in the morning? Maybe atakuna breakfast hiyo siku. So maybe atabrush tu yaende siku zake. So I want us now to get into that practical session of now actually brushing the teeth. And this cuts across for someone who's even below 18. A teenager maybe, someone who you're trying to teach at yote brushing the teeth, and then now even for an adult. Yes. Good.
So now, actually, even before I start the brushing, I want to just put this across. The best, we have 2 sets of people. We have the adults or the children who are a little bit grown up, like 8 years and above. And then we have the infants, the ones who are in between here. So most people will ask, when is the best time to start brushing my teeth? So the first, for young children, immediately they are born, the best time to start cleaning their teeth, let me stop using brushing, cleaning their teeth is immediately. So the moment they are born, they usually don't have teeth, but they have what we call the gum pads. So what you're supposed to do is, after breastfeeding, the mother is supposed to take a cloth and then just pass around the gum. Yes, you're not cleaning the teeth, but that motion makes the baby to get used to things being put in the mouth. Then the teeth will come in at around 6 months. So at that age, again, it is very, very important. And this one the mothers need to hear. It's very, very important for them to be cleaning the teeth after breastfeeding. Because the reason why we are cleaning the teeth is to reduce the amount of sugars in the mouth, or the food debris that is in the mouth. So the moment you breastfeed, breast milk has a lot of sugars. So, and this will be left on top of the teeth. And even if it's not breastfeeding, even the baby bottle, ile mnyonyi, wakinyonya, just before they go to sleep, there's usually some milk that is left inside the mouth. And that is what causes damage to the teeth. That's why you hear mothers saying, mtoto wangu meno zake zinakatika. So it is very important after breastfeeding, ama kupatia mtoto maziwa, unachukua, sasa hiyo huwezi tumia brush juu ni mtoto sana. Unachukua tu kitambaa, unapanguza hizo meno, hata kama ni usiku. Actually we tell mothers, usizoeshe mtoto wako kulala na hiyo mnyonyi. Hiyo mnyonyi inafanya hizo meno zipate hizo cavities. It's called early childhood caries ama baby bottle caries. Hiyo ni kuchimbika meno juu ya maziwa. Most parents think they're not supposed to brush. Now for young children who now have a full set, like 2 years going all the way to 8 years, we normally say they do what we call assisted brushing. Assisted brushing is saile the mother or the guardian or whoever is there is the one who's assisting the baby to brush. Because at that age, bado haja develop what we call the manual dexterity to be able to move their hands and be able to clean properly. Yes, you tell them to brush, they'll rush, they are going to brush, but they are not going to do a good job. So you're supposed to assist. Probably anaweza brush asubuhi, and then during the night, you make sure you're the one who's brushing.
Wacheni kurudishe back to hiyo maneno ya meno kuvunjika, that the mother, the parent would really raise as a concern. At one point in life ya mtoto, hizi meno zitakuja kung'oka tena na zingine zime. So why ukiangalia at the end of the day bado itakuja tu kung'oka. So explain to us.
I like that, if kazi ilikuanga tu zing'oke, why did God give us those teeth? They are very important teeth. Those milk teeth, they have 3 functions. Number 1 is what we call mastication. Hizo meno zinasaidia mtoi kukula. So if, for example, a baby loses the molars at the back, then their nutrition is affected. And remember, this is the time they're supposed to be growing. So they help in mastication. And even if you leave them and they start getting cavities and you remove them, then you are affecting the masticatory function. Hiyo ni kutafuna, all right? Those teeth are also important in terms of aesthetics. Venye mtoto anakaa,
okay.
Right? Then important na function kama ya speech. Remember, this is the time the baby is developing speech.
Okay.
Uking'oa hizi meno za mbele, for example, kuna words mtoto hataweza kusema, because some of those phonations they are assisted by the teeth. Yeah? Kama kusema kitu kama S, ukisema S unasikia meno zako zinaguzana. Yeah? Kama una meno hapo hivyo hata unapata mtoto anashindwa hadi kuongea. Thabutha. Yeah? Unapata mtoto anashindwa kuongea, wewe unampeleka kwa speech therapist, kumbe hata ni meno iko na shida. Alright? Then the most important thing is those teeth are meant to preserve the space for the permanent teeth. So ni ile unaambianga msee bwendo unishikie kiti na kama. Okay. So if you remove those teeth earlier, what will happen is that space collapses, and then now when the permanent tooth is ready to come into the mouth, there is no space. All right? So they are very, very important. And that's why we are saying even for kids, we need to take care of those milk teeth until the time comes when they are supposed to fall out and the permanent teeth to come in. So at that age, it is actually very, very important that the parent makes sure that they're able to brush their teeth.
All right.
Yes, and then now for the adults, of course, we've already said it's at least 2 times a day, in the morning and the evening. Now, like we said, introduction of a brush should be, between around 2 years. Then the other important thing is you're not just using a brush, there's a toothpaste. Now, I want to say this, toothpaste is actually a medication, all right?
Okay.
Unakumbuka last time when we were here, we talked about dental fluorosis and the way the fluoride causes meno kuanza kutokana na kukaa brown. So sasa toothpaste inakuanga na fluoride mingi sana. The recommended fluoride in drinking water, we said, is 0.5 milligrams per liter. Juu ni maji unameza. Sasa toothpaste inakuanga na fluoride iko 1,000 milligrams per liter. Why? We normally say fluoride is an angel when used on the teeth. Like saile unaitumia juu ya meno. Lakini it is a devil when you swallow it. Juu ukiswallow ndio inaharibu meno na bones. So even toothpaste, kuna watu wengine wanaekanga toothpaste wanaanza kumeza.
So it means that kwa age because ndio introduce mtoi for the toothbrush, amaanisha pia even for the toothpaste.
Yes.
For uangalie what kind of toothpaste that you're also introducing, because a number of brands have specific toothpaste brands specifically for children that are quite refreshing even in the mouth. They have a certain taste. They won't be as dull as what the adults would really use. Why is that though? Is it the fact that because many would really attempted to even swallow it? Watataka kumeza hii nini?
Toothpaste. Actually, for me, I don't advocate for. Of course, I'm not here to market any brand, but I don't advocate for any particular brand, and especially the ones that are sweetened. Because what you're doing is you're encouraging that baby to swallow that toothpaste. Because inaonja kama chewing gum, inaonja kama nini, so atameza. And you say the moment they swallow that toothpaste, it can give them dental fluorosis or even skeletal fluorosis on the bones. So we want the baby, especially saili anaekewa hiyo toothpaste, again, ekewe kadogo sana. Pea size. Kuna wase wana covering the whole toothbrush na paste. Inafaa kuwa kadogo like a pea. Ona ile dengu. Kale kadogo kabisa.
Ndio hata chances of
hata akimeza, chances ya kumeza hata akimeza ni kidogo. So unaweka kidogo, alafu sasa ndio tunaanza kubrush. Even for adults, you're not supposed to cover the whole toothbrush with the toothpaste. I mean, najua sasa hii kwanza economy ni mbaya sana.
I know.
So, unaweka tu kidogo. Unaweka kidogo. Hiyo toothpaste ni dawa, And the reason why nilisema ni dawa, inafaa kuwekwa mbali. So even the kids are not supposed to just be playing around. The same way you cannot put paracetamol or amoxil just for them to, sasa ile anataka kunywa dawa unamwambia endo ujieke. Huwezi mwambie hivyo. So wewe unafaa unamwekea, unampimia kadogo.
The dogs kuna toothpaste zenye zina fluoride.
Ziko, lakini we don't recommend. Remember we said fluoride inasaidia ku-strengthen meno na ku-prevent cavities.
So ni dawa ikiwa kwa
dawa. Sasa ile inatumiwa kwa meno ni dawa. And it's very, very important. It helps with prevention of cavities. shida ni ikimezwa. And that's why you are saying even that toothpaste unafaa wewe ndio unamwekea juu ni dawa. The same way mtu akiandikiwa amoxil ndio unampimianga. Unamwambia 5 ml chukua. So unamwekea ka toothpaste kadogo, unamwambia endo brush, ama wewe unaenda unambrush. So unaweka, and then now we start now the brushing. So toothpaste, you can use any toothpaste because it's just a cleaning agent. Right. So long as it is fluoridated toothpaste. Kuna wase huku nje wanasema wanajifanya woke sana. Ati mimi I don't use fluoride. You need fluoride for your teeth, we normally recommend, especially for children, to use fluoridated toothpaste. The only thing is avoid swallowing and the dosage. You just use kidogo.
So umse mwenye hatumii hiyo non-fluoride, what effect will it have kwa meno yake?
No, utapata sahi they become more prone to cavities because the whole point of the fluoride is hata sahi ile umebrush kuna yenye inabakingi kama imecoat on the tooth. Yeah, so it forms something you call a fluoroapatite layer. So it just covers and protects the teeth and prevents the cavities.
Right. Yes. Before tuingie kwa brushing, a reminder to wenye wanatuwatch sahi, maybe pia kwa hiyo process ya na brush meno wakituwatch sahi, 0795045864 ndio namba ya kutupigia simu. Tupigie simu maybe for the kind of feedback ama maswali uko nayo yenye doki atakuwa na jibu. How do you take care of your oral hygiene? Unaweza tuambia pia the kind of process yenye unachukuanga. 0793267279 ndio namba yetu ya WhatsApp. Unaweza tutext pia 22047 at TV47 KE. Tupigie simu tuambie hizo maswali zote uko nazo. So we've taken a look at the toothpaste. Na tuingilie kwa the toothbrush itself. So kama hii at least si ngumu, iko at least soft. Na hii inaweza pitia kwa hata kwa gums vizuri. Tell us the recommended nikienda sahi kubuy toothbrush. Naangalia nini kwa hii toothbrush? Because I mean, okay, sitakuwa imefunikwa, so I can't really I can't really start touching the bristles zake. So I'll have to gauge it just nikiangalia tu nijue iko sawa. Or rather I trust the brand. Okay, hii brand nimetumia iko sawa. Ama it's a recommended brand because of ABCD here. So hizo ABCD ndio nataka utuambie.
Alright. Why
do I pick a certain toothbrush?
And that's why we are here, so that's tuchanuane, right? So now there are normally 3 kinds of toothbrushes. So there is what we call the medium, the soft, medium, and hard. So those are the 3 types of toothbrushes. So now, a good toothbrush, number 1, should have a sizable head. Head sasa ni kuna kuanga na vitu 3 kwa toothbrush. Kuna kuanga na the head. The head is this one here. Then we have the bristles, and then we have the handle. All right. So again, depending with the age of the person who's using the toothbrush. Like for kids, of course, you want a small head because their mouth is also small. All right. Then for adults, the normal size of the head. Now, the most important bit is actually now the bristles. Now, the recommended one is medium. Na hizo zinakuanga zimeandikwa juu ya the wrapping that is around the toothbrush. You'll find that there are some that are written hard, others soft, and others medium. So we recommend medium, all right, for adults, all right? So for kids, normally unapatanga ni soft or medium. Rarely will you get a hard toothbrush. So if you get a brush that is very hard, inamaanisha, it is going to cause damage to the teeth.
He had ni kidanani because at the end of the day iko kwa market. Iko kwa soko. So that means it has a target audience. Who's the target audience for the hard?
No, there are people who like, the market is usually dynamic. Ni kuuza wanauza. So there are people who like brushing their teeth, like they are scrubbing the floor. You are kwa sitting room, unasikia msee bedroom. So, and others think because they are smokers. Now they have, to use a tough brush to remove those stains. But at the end of the day, actually, what you get is, those people, if you use a hard brush, you're going to get what we call abrasion cavities. Abrasion ni kwa sababu hii bristles ni ngumu sana, it's actually abrading on the teeth. Because now when you use a lot of force, what happens is the gum that is covering the tooth here, That brush, because of the continuous motion.
Naomba tuchukue call ya Nancy before tuendelee na hiyo practical.
All right.
Nancy, habari asubuhi?
Nzuri.
Thank you for calling us. Uko na swali au kuna maoni?
Niko na swali.
Yes, uliza.
Nauliza, is it a must kama una brush meno ukitumia any toothpaste urinse na maji? Maana naonanga hata wengine wana brush tu hivyo alafu wanatema alafu wanaendelea na shughuli zao.
Sawa. Anaweza kujibu tu hiyo sahihi kabla tuendelee?
Yeah, so there are many schools of thought on that. There's actually recommendation where, especially if you use a non-foaming toothpaste. Non-foaming ni ile haitoi ile foam. You just spit and then just continue like that, because you want, again, the protective action of the fluoride to remain on the teeth. Nowadays we even have what we call waterless toothpastes, right? There's one called Enzi. I think it's in the market in Kenya. It's just been introduced. It's a tablet. You just chew on the tablet, then brush, and then you don't need water. Wow. So the good thing with that is it is going to leave the protective action of the fluoride on the mouth. But then again, for kids it's debatable, because then the kids will keep swallowing that. So it's a bit debatable. Now for adults, if you have a foaming toothpaste, of course, hautaki kwenda na mavitu za white everywhere. So we recommend at least you rinse, but don't over rinse. You just rinse, just to remove the foam that is in the mouth, and then you can just move on.
Right. Yeah. So you're back to explaining to us abrasions.
Yes.
So you mentioned that itafika kwa. So which part of is it the teeth or the gums that are most susceptible to the abrasions? Because niki hata ukiguza meno, it's quite hard.
Yeah.
So are the teeth really susceptible to these abrasions? Ama hadi guze gum, utasema hapa unaumiza gum na si meno.
Yeah. So if I may demonstrate with this model, actually, let me just use this. So this is how a tooth looks like. So this is the gum.
The gum.
Then this is the tooth itself. Then up IV, there's usually a space. It's called the periodontal pocket. So it's like the way on your nails you have some space where that usually hides on your nail beds, right? So there's usually like a 2 millimeter pocket over here. Now, if you section this tooth, this is how it looks on the inside. Okay. All right. So you have the outer layer, which now you're saying is a hard. This one here.
The enamel.
The enamel. Good.
Nakumbuka biology.
Sahi naona karibu daktari pia.
Ndio.
Good. So we have the enamel there, and then hapa hivi ndani kuna kuanga na kitu inaitangwa dentine, all right, which is the middle layer.
Okay.
And then of course the inner layer of the tooth is called the pulp. That's where we have the nerves and the blood vessels. Now, hii ya nje, it's actually the hardest part of the body. Enamel. It's very, very hard. And as you can see from this model here, it only covers the outer surface. It does not extend to the root. The root is made of dentine. So now what happens is, and as you can see, the gum is right there. So if you use a lot of force, or you use the wrong brushing technique, or you use a tough brush, this gum starts running away from the tooth. So it starts what we call receding or recession. So inaanza kuteremka. So ikiteremka, it exposes the root, which is made of dentine. Now dentine is very soft. So now the abrasion cavities that you're going to get are usually hapa hivi karibu na gum line, kwa sababu hapo ndio dentine iko, and the dentine is very soft. So the abrasion is not on the enamel. It is the gum first recedes, unapata gum recession. Ikirecede, ina expose the root, which is made of a soft material called dentine and cementum. Then now when the brush, continuous motions of the brush there, it creates cavities. That's unapatanga kuna watu, just where the gum is, there is a trench. It's because of the abrasion action of the brush. So wrong brush, wrong technique, and sometimes you find that the force they use is just too much.
So if umsenaendelea kutumia hizo, alafu amefika hapo, and so chances are, because these are blood vessels here, and this is a very soft bit, so that means there's going to be ataanza kuona damu hapo, and obviously also pain, because if the abrasions would definitely cause pain. So are these two the it's the symptoms zenye if you're really using hard bristles on your toothbrush, you might really start seeing and warn, acha nirudi kwa soft.
Actually, what happens is, you see this, because this outer layer, the enamel, is very tough. It's actually non-living. Okay. So it means it doesn't feel any pain. But the dentin, it has some fibers, as you can see even on the diagram there. I mean, on the model, it has some fibers. So it is semi-living. So the moment now the gum starts receding, hapo ndo unasikianga mtu akisema anasikia sensitivity. So hot, cold things, or even during brushing, I'm feeling sensitivity. Why? Because this is not like enamel. It's usually sensitive to hot or cold. Unapata, even hot things, cold things, you're feeling sensitivity. And it's not because of a cavity, the normal cavity, it is because of gum recession, which has exposed part of your root and therefore exposing the dentin. And if it continues too much, then it gets to the nerve. That's happened in a pain. Okay. The nerve is where you start feeling pain.
All right, hold that bit, human in pain. We'll be getting to that after this short break. You're watching Morning Cafe. We want to understand, how do you take care of your oral hygiene kutoka uamkia asubuhi hadi jioni? Unachungaje mdomo yako? Later on we'll be getting to understand. Saa zingine yes, umebrush meno yako yote, lakini bado kuna karufu fulani tu uko nayo ukikaribia watu. Shida inaweza kuwa nini? Call in live after this short break, 0795 045 864. Don't go too far.
Kila kiongozi ana hadithi yake ya kipekee.
Wazazi wangu walikuwa bit strict kwa sababu mamangu mwenyewe, mimi kutoka kuzaliwa sijailala nje.
The white small one, huyo ana sniff gunpowder na risasi na bomb. Alafu huyo mwingine ni ridgeback, ana sniff simba.
Even the employees knows that. So when in the boardroom is the chairman, the CEO, and the rest of. At what point are you a wife? The minute you get to that, inside that door, you become now the wife.
Na kila maamuzi wanayoyafanya hufichua mengi kuhusu utu wao na uongozi wao.
We see God blessing us, and we now realize the power of giving also has to be rewarded back.
Kupitia kipindi Mfahamu Kiongozi, tunakuletea mahojiano ya kusisimua na uchambuzi wa kina kuhusu viongozi wetu.
Pick your core business as the bigger stones. Put them in your diary first. Give priority the bigger things.
Usikose kila Alhamis saa 1:30 jioni.
In a world where challenges are as common as opportunities, there are those who dare to defy the odds. They are the entrepreneurs. Entrepreneurship isn't just about starting a business. It's about embracing uncertainty, pushing boundaries, and turning dreams into reality.
Hata ambao ni pesa ya kusave, wallahi. Mbao mwaka ni pesa nyingi sana.
As long as you're earning something, there's always that opportunity to save. And you start with where you are.
The way we run the business is in a very unforgiving way, where every team member has to bring out their best.
So, to all the dreamers, innovators, and risk takers out there, remember, being an entrepreneur isn't just a job, it's a way of life. Join the journey. Become an entrepreneur. The Grind, Mondays at 7:30 p.m.
Here on Beyond the Limit, we celebrate the extraordinary achievements of individuals who redefine possibilities. In a journey of resilience and determination, these individuals demonstrate that limitations are merely stepping stones to greatness.
I'm Nancy.
This is Morning Cafe. This Monday we're discussing oral hygiene. How do you ensure that your oral hygiene is as fantastic as possible from when you wake up in the morning all the way hadi evening? Kupatana na mtu umemsalimia into the evening, you still have that fresh scent, and we'll be getting to understand yote, how do you actually maintain it? So before the break, Dr. PJ Muruki hapa amekuwa kituelezea anatomy ya oral anatomy venye inakaa, and what we need to know, even the toothbrush, the toothpaste that we also need to know. Maneno ya non-fluoride tuachane nayo, use fluoride lakini in pea size, yes, in the pea size. And so as we take the short break, we'll talk about the hard bristles on the toothbrush, which can really cause sensitivity later on. And so my question now really goes to, so for example, someone is using, let's say the medium or soft bristles on the toothbrush, but then they experience sometimes blood on si ile ina flow sana, ile kidogo tu drops of blood on the teeth. For example, kama ni hii, so you'd find, so as you're brushing, you'd have probably ni gums juu imeumia ama ni nini, unapata blood kidogo hapa. When you rinse the mouth, imeisha. What could be the cause of that?
So two things. Number one, it could be if someone has healthy gums and they're still bleeding, it could be that there is some trauma. You know, sometimes when you're brushing, some bristle might injure the gum and you have bleeding. So that should happen once, or one-off. It's not supposed to be continuous. If it is something that is happening all the time, every time that you're brushing, it is most likely that you have what we call gum disease. Because like we said, in the anatomy of the tooth, there is that space that is usually there between the tooth and the gum, that pocket. You remember we call it the periodontal pocket. So that pocket usually hides a lot of dirt. And for most people, when you're brushing, you're not able to get the bristles to clean that periodontal pocket. So when the dirt and the food and the bacteria stay there for some time, what happens is they cause irritation to the gum, and the gum becomes inflamed. So when it becomes inflamed, it's what we call gingivitis. Gingivitis, basically another name for the gum is gingiva. So whenever you add itis, it means inflammation. So gingivitis, because of the food that has been packed in the periodontal pocket, akoka pocket tumesema iko between the tooth and the gum. So that inflammation, imagine nikaa kidonda, place imefura, you know. So every time you come with your brush and now you touch that gum, it starts bleeding.
And something still connected to that, for example, is having ile miwa, ile kubo ile, mirarua nini, alafu makosa ikafanyika nikajiumiza kwa either kwa ulimi ama somewhere in, let's say kama hii, model, so on the gum, for example. Can I still brush my teeth?
Yeah, that's now what we're calling a traumatic bleeding due to trauma. You know, ni kitu imekudunga, either ni brush ama ni hiyo miwa ama ni kitu ingine. So that should be one off. But so every time...
Do I avoid that place that is injured when I'm brushing?
You avoid it because, of course, every time you're brushing, you're going to, remove the clot that is forming, and it will keep bleeding and it will not heal. So where you're having consistently, whenever you're brushing, there is blood coming out, it means it's a disease. It's actually what we call gum disease. So ni hiyo yenye tunaita gingivitis, because there is a lot of food that is, or debris that is packed there. And this is very common for people that tukijiangalia unapata kuna some black or brown stain that is just around the gum line. All right? Hiyo uchafu ikikaa hapo, for some time, the calcium in the mouth usually solidifies it. Inashikilia kwa meno kabisa. So initially it's usually soft, and that is what we call plaque. And that's why we say you have to brush every so often to remove the plaque, to prevent the plaque from hardening. Because the moment it hardens now, even if you use a brush, it cannot come out. And then it hardens is now what we call tartar or calculus. All right? So inakuwa hapo hivyo ndani.
Calculus hadi kwa mdomo.
Hesabu mbaya. Mwalimu wa math hadi kwa mdomo. So unapata hiyo calculus inafanya nini? Ina solidify kwa meno. Now it becomes as hard as a tooth.
Right.
So even if you use your brush to clean, it cannot come out. And now, the moment now you have, when you have plaque is when you have gingivitis, because, it's not solidified. The moment it solidifies, now we have what we call periodontal disease. And now there, you have to see the dentist to be able to remove those stains. And that's why you see people with some, black stains around the gum, and, at that point, even the gum starts receding, and, it's a whole disease, what we call periodontitis or periodontal disease. Right. And that can only be removed professionally by the dentist.
All right. Yes. I want us now to get into the practical bit of it. Everyone has their own methods of brushing. Some studies show, and other articles would probably say, do it up to down, left to right. But then at the end of the day, it's not set, it's cast to stone. I think this is the kind of method you should follow. Easy mathematical equation, lazima uonyeshe equation. Some would say at the end of the day, as long as mendo imeng'ara. But then for you and your experience in what you've seen over the years, unaweza tuonyesha, if now nimechukua my medium bristles, rather soft toothbrush, nikaeka pea-size toothpaste, fluoride toothpaste, nataka sasa kuanza. So how do I start?
All right, so basically we want to divide, the mouth into 4.
Okay.
So we call it the 4 quadrants of the mouth, all right? So ukiangalia kwa hii model, so tukidivide hivi, alafu to divide hivi. So kuna left, right, so upper right, upper left, lower left and lower right. All right? So that is how you divide your mouth. The most important thing is how you angulate this toothbrush. Once you put your toothpaste here, we want to start with the back teeth, all right? Remember, at the back, you have 3 surfaces. Kuna hii towards the cheek, there's the biting surface, and there's the one which is towards the inner side of the mouth. You want to brush all of them. Now, the strokes that most people do is what we call horizontal. So unapata mse anafanya, you're just cutting across the gum.
Yeah.
This is not recommended because this, this is what people do.
Yeah.
This cuts across the gum and it will cause gum recession.
Okay.
All right? So the way the bristles of a brush are made, they are meant to cover at least 2 to 3 teeth maximum. All right?
Okay.
So what you're supposed to do is, number 1, make sure you angulate your brush. See, we are starting now with the upper side. You make sure you angulate your brush 45 degrees. And why are we doing this? Is so that when you're brushing, some of the bristles are able to get into the periodontal pocket. Because ukieka hivi, if you put it like this, you're just brushing the tooth alone. But if you angulate, it means as you are brushing, then some of the bristles are able to rub against the periodontal pocket and remove the food that is packed there. So like we said, you just cover like 3 teeth, like that. And then what we want to do is circular motions, like this. All right? So we don't want to do that. So we just want to do circular motions. So like if I demonstrate on myself, so it's like this. I'm brushing the upper right side, bristles angulated like that, and then now I'm doing circular motions. All right? So the brush is in contact with the 3 teeth at the same time. So like that. All right? Not like this. So you move like that.
So many people are doing that wrong.
Yeah. So you are moving, in circular motions. This prevents you cutting across the gum, because when you are doing this, it's, you are injuring the gum, and the gum, itakangi ngori. If there is any trauma, it will run away. So when it runs away, exposes the root, and then you start getting sensitivity. Because of the abrasion cavities. So you do that, all right? Then, again, now, where you can do the horizontal strokes is the biting surface. So the biting surface, again, you make sure you do like that. Then don't forget the inner side. The inner side, again, we do just like we did. You angulate the brush like this and clean on the inner surface.
Okay.
So this movement is what you'll repeat on all the 4 quadrants. So here, there, then down. Now, on the upper side, of course, you're angulating 45 towards the gum. But on the lower side, the gum is down. So you're angulating 45 degrees towards, again, the gum. So it's facing down like this. So it's like this. Yeah. Then, again, contact the teeth, 2, 3 teeth. It's like you're massaging the teeth, really.
Okay.
And you just use some gentle force, not too much. So that way, you are able to clean the tooth rather than ile ya kupitia. So ukifanya hivyo unapata the concave part of the tooth will not be reached by the brush.
An additional, because you told us we put a pea size of the toothpaste.
Yes.
Fluoride toothpaste on that. So you've been doing that for the first, for this side, hapo vizuri chini na pia hapo ndani, on both sides.
Yeah.
And because you're using a pea sized, you, even inside your mouth, you can feel like
you don't have enough toothpaste.
Yes, you don't have enough.
No, if you have...
There's temptation of adding more. Are you allowed to do that?
There's no harm in adding, should you feel like. But then again, the most important thing is, toothpaste is a cleaning agent, all right? So if you have a very nice cleaning agent, or even a lot, and you don't know how, it's like washing your clothes. Kuna sabuni poa sana, but you don't know how to scrub. That cloth is not going to become clean. So that's the same thing. So the most important thing is how you do it, the technique of how you do it, and not so much. Actually, for those people, especially when you are mashambani and probably toothpaste is not available, even the stick, the chewing stick, we actually recommend it.
Really?
Yeah, we recommend it 100%,
But hiyo haina fluoride?
That's the thing. If we are saying fluoride is a protective agent, all right? But it is not the one that is cleaning, it's you who's cleaning the teeth. So the cleaning, gadget is the brush. So whether it's a twig or whatever, it's going to disrupt the formation of plaque. Because the enemy here is the plaque, right? So whatever way that you're going to remove it, we do it. But in cases where someone is not able to access fluoridated toothpaste and still cleans, you'll find they have perfect teeth. It's only that now, the protective action of the fluoride in the toothpaste is not there. But mechanically, they are cleaning the tooth properly and they'll not have any problem. So it's not a must for us to use the commercial brushes. So long as, again, even with the twig, don't it's not a floor that you're scrubbing. You just slowly, una massage too along the gum, and that disrupts a lot of. You find some of those people who are always with the stick, they have perfect teeth, but some of them now they have perfect teeth but with abrasion cavities because they are overdoing it. So it's about the force and the technique.
And speak of technique, because so you have this one that you yourself are controlling.
Yes.
But then there's the electric toothbrush that you just have it in your mouth and it's doing the magic.
Yeah.
For this one, are you able to control how you angulate the 45 degrees, all that, because it's electric, so there's a way even the bristles will definitely move in circular motions. Unaweza achieve hizo vitu zote zenye unatuambia with an electric brush?
Yeah, and even before I go there, we've already cleaned the back teeth.
Yeah.
So at the front teeth, again, we also need to make sure that we are angulating our brush and cleaning. So at the front, you can either do the same circular motions or you can do up and down, all right? Then the most important thing, you do that also on the lower side, angulate towards the gum so that you clean, and then you can do up and down like that. The most important place where most people forget is the inner side. Yeah. And that's where you find most of the people have a lot of stains on the inner side. And it's because it's not easily accessible. And number two, it's not a place where people see. So people tend to ignore because people are more concerned about what people see.
Yeah.
So the inner side, again, here on the inner side and also on the inner side of the front teeth. Once now you finish cleaning the teeth, like you said, the back side and everything is the same way that I demonstrated here. You rinse your mouth. Rinse your mouth, then rinse your brush. Then the most important thing is you clean your tongue. Because the tongue is usually very dirty because it has, the papillae, the two small bumps that you see on the tongue. It's like a cloth, the way a cloth has microfibers, right? So remember, all the food, any drink you're taking has to go through the tongue.
Through the tongue, yeah.
So it usually has a lot of that. And for some people, you might find the tongue looks whitish. That is not normal, all right? So that white is the same plaque that usually covers on the teeth. So it's plaque that has, not been cleaned. And therefore, you are now supposed to gently brush the tongue all the way to the back until you feel like you want to puke, and then you stop it. So brushing the tongue is very important. That's why most people will say, I brush my teeth, but I am still having a smelly mouth. Could just be as simple as you are not cleaning the tongue. So for the electric toothbrush, again, control is very important. They are very, very good, but then control. Because remember, this one, you are the one who's in control. But for the electric toothbrush, it is the machine which is moving. So again, the same technique, you have to make sure that it is in contact with the tooth, you angulate, and use gentle force. Most of them, the good ones, usually have different frequencies. So you choose a frequency that is medium, or low or medium. Then you do that. And then the same technique, make sure you brush all the aspects of the teeth. They were made for people who are not able to move their hands, either disabled or children with special needs. That is the target market for the electric toothbrush. So if you're able to use your manual toothbrush, it's good, but also studies have shown electric toothbrushes are more efficient in terms of cleaning. But again, if you're not careful, it will cause gum recession and abrasion cavities.
Right. Yeah. Speaking of something that was meant for certain people, when you have the, I forget the name, is it chuma?
Braces.
Yeah, the braces.
Yes.
How do you also brush your teeth when you have braces?
Yeah, so there's some instructions that we normally give patients on how to brush. So the technique is the same, just slight modification to take care of the fact that there is braces, running across. But the most important thing is now you have to brush even more times. Because now there are foreign bodies in your mouth which attract or retain more dirt. It's not like a tooth which is just clear like this, smooth. Now there are other things that can retain a lot of dirt.
So that means even how you angulate here.
Yeah, how you angulate. Totally we even give them special toothbrushes, including what we call interdental brushes, just to be able to clean in between the tooth and the wire. Yes.
Right.
Yes.
And because a number of people, unatumia toothbrush, utaiweka vizuri, you close it up. And actually, even before now we get into how long you need to change it up, there are certain brands that will give you, so for the toothbrush, so there's a case that you have. So help us understand that. Do you have it in a case, or do you have it in open air and let the bristles also ipigwe na baridi kidogo? What is the rationale of that?
No, mostly the casing is just for hygiene purposes, and mostly when you are probably traveling and you want to carry it around, it's not meant to you brush and then you close it up. It's, we normally recommend that it is aerated. Did you know that ukipata homa unafaa utupe toothbrush?
Yeah, okay.
Yeah, so after...
Kwanza hii season ya baridi.
Yeah, so you're supposed to change your toothbrush after a bout of flu, because remember, even during that time you are brushing, and most of the time you find that the bacteria or the virus that is causing itafanya nini. So you're supposed to either disinfect the brush. There's a way that we use. You can use what we call a quarter strength. That is peroxide. You mix 4 portions of water and 1 portion. It's called quarter strength. Just dip it there and disinfect it. Or it's actually recommended if you're able to every probably 2 weeks you just disinfect. But of course that's sometimes it's not practical.
So does this come, because I've seen this hata pale ushago utaona mtu ataweka maji warm, ataweka chumvi kidogo ndani alafu adip hapo.
It helps. It helps. It's just decontamination really of the bristles, and that's why we say, for example, if you have an illness, then you might need to change your brush. But other than that, the bristles should always be straight. So the moment you see them zinachapa kona or they're becoming flat, then it's about time you change that brush. But we normally say at least within 3 months, you change the toothbrush. So whichever comes first, either the illness or the bristles are bending, or 3 months. So you just deal with whichever comes first.
So in 1 year, at least umekuwa na 4 toothbrushes.
Yeah, recommended. Yes.
Yeah. Right. Yeah. Something else that we need to remember, because we will take a look at hypothetically, umeamka asubuhi, umebrush asubuhi after breakfast.
Yeah.
Ukaenda shughuli zako, so definitely hautabeba toothbrush when you're going in your business. When you come back at home, before supper. So before supper, after supper?
It's supposed to be before supper, and I'm really happy because there are some schools even who have a brushing program for kids. Because remember, our diets have really changed, and we are eating a lot of sugary things and you know, what we call keratogenic diet. Keratogenic diet is diet that is going to, you know, make your teeth have issues, including cavities and gum disease. So there are kids who actually have toothbrushes in school, and that is really commendable. After lunch, they all go to the tap and they brush their teeth, which is very good, because what we want to do is to disrupt this thing that we are calling plaque. What is plaque? Plaque is a combination of the food leftover and the bacteria in the mouth. Now, your mouth pH, sinakumbuka pH, when you are in high school, so the pH level should be neutral. It should be around 7.
7,
right?
yeah, 7, yeah.
Now, you have millions of bacteria in the mouth.
Back,
Yes, yes. Yeah, so you have millions of bacteria in the mouth that are what we call normal flora.
Okay.
Under the neutral conditions, those bacteria, we have what we call a symbiotic relationship with them. Zinatusaidia na sisi tunazisaidia. Because remember, we learned that digestion starts in the mouth. So some of these bacteria actually produce some enzymes that are important in the digestion. So it's a symbiotic relationship. The problem is now when the environment in the mouth changes. When you don't brush, the mouth becomes acidic. So there's a lot of change. And now these bacteria that were good, they turn out to become harmful, and that is what causes bad breath. It's the one that causes gum disease. It's the one that causes cavities in the mouth and other things. So if you are able to brush, if you're able to carry your toothbrush and you even brush after lunch, whatever time, the enemy here is the plaque. We don't want the plaque to accumulate in the mouth. And that way, that's why we say you disintegrate. And, you know, people like you and me who are, you know, busy and you might not get that time, sometimes we even recommend sugarless chewing gum. Because what that does, the moment you're chewing, remember I said you have the parotid gland, submandibular, sublingual, they all produce saliva. So the moment that chewing action, it compresses the glands and they produce more saliva.
Right.
So the saliva is going to give you the self-cleansing, you know, ability of the teeth in the mouth.
Right.
Yes.
Daktari, allow me to end this practical conversation here.
Yes.
Maneno ya oral hygiene. Probably in very few seconds.
Yeah.
Your last thoughts.
Yeah.
Particularly where someone can reach you.
All right. Good. So I think this is very nice, and I like the fact that we are demystifying dentistry. I normally say that the mouth is the window of the body. So you cannot claim to have good overall health without proper oral health, because nutrition starts in the mouth. So if you're not even able to eat because your teeth are having issues, then even the rest of the body is going to be affected. So it is important to know that almost all oral health conditions are preventable. And the first way of preventing it is by brushing.
Right.
So we need to make sure that we maintain our oral hygiene.
Right.
Now, for how you can reach me, you can do it either on Facebook or Instagram. PJ Murioki is my handle, and if you have any question, you can inbox, and then we can take the conversation from there.
Right. Yeah. Speaking of conversations, that is where we definitely wrap it up on this Monday, Health Monday. State of the Nation was before that. Thank you very much for sticking around. Tomorrow we do this again with Fred Indemuli and I standing in Ringita all the way to Friday, just making sure that you start your day in a very, very fantastic way. Till then, kwaheri for now on behalf of the entire team.
Thank you.